Call to order. It's a Public Safety Committee. It is 6:50 p.m. We have one item on the agenda tonight. It's order number 26-100-9773, a City Council resolution in support of a nicotine-free generation policy. And I'll read this very quickly, as quick as I can. That the resolution in support of the nicotine-free generation policy be and is herewith referred to the Public Safety Committee. Resolution in support of the nicotine-free generation policy, whereas the City of Marlborough recognizes that nicotine addiction remains one of the leading preventable causes of illness, disease, and premature death in the United States. And whereas the use of cigarettes, cigars, smokeless tobacco, vaping products, nicotine pouches, and other nicotine delivery systems have contributed to increased rates of cancer, heart disease, respiratory illness, substance dependency, and youth addiction. And whereas the city acknowledges the growing public health concerns associated with youth, vaping, and nicotine use, particularly among adolescents and young adults. And whereas nicotine products are intentionally designed to create dependency and addiction, often beginning before adulthood. And whereas communities across the nation are exploring innovative public health strategies to prevent future generations from becoming addicted to nicotine products. And whereas the City of Marlborough desires to promote healthier lifestyles, reduce long-term healthcare costs, improve public wellness, and protect future generations from nicotine addiction. Now, therefore, it is resolved that the City Council of Marlborough supports this creation of a phased nicotine-free generation policy designed to gradually eliminate the legal sale of nicotine and tobacco products to future generations of residents. Be it further resolved that any individual born on or after January 1st, 2010 shall permanently be prohibited from purchasing nicotine or tobacco products within the City of Marlborough, once enabling ordinances and regulations are adopted, that this policy shall apply to all nicotine-containing products, including but not limited to cigarettes, cigars, vape products, and electronic nicotine delivery systems, smokeless tobacco, nicotine pouches, and synthetic nicotine products, that the city shall implement the policy gradually in order to educate residents and retailers, provide smoking cessation resources, reduce youth nicotine addiction, support public health initiatives, that the city encourages partnerships with local schools, healthcare providers, addiction recovery organizations, and community groups to educate residents about the dangers of nicotine addiction and to promote prevention and recovery services. That the city supports the expansion of smoking cessation programs, counseling services, and recovery support opportunities for residents seeking to overcome nicotine addiction. That the city clerk shall forward copies of this resolution to the Massachusetts Department of Public Health, legal legislative representatives, the Marlborough Board of Health, and other appropriate agencies for review and considerations. Be it further resolved that this resolution represents the city's commitment to safeguarding the health and well-being of future generations and creating a healthier future for youth of Marlborough. Along with that resolution submitted by Councilor Vital, along with that resolution was a letter of support from the Director of Public Health here in Marlborough, Paul Dinwiddle, who I'm not going to read his entire, but he's very much in favor of this resolution. And then also a student over at the Advanced Math and Science Academy, she is the president of a club called the 84 Movement, which is a state initiative to the public schools trying to eliminate nicotine in all forms. And so she sent a letter of support as well. I would entertain a motion to accept the resolution.
So moved.
Not on the committee.
Oh, I thought you wanted to accept the motion.
Yes, Councilor.
I move to accept the resolution.
Thank you. The resolution, a motion to accept the resolution has been seconded. All those in favor?
Can we have
Discussion? May we have discussion first? Yes, Councilor.
Thank you, Mr. Chair. Admirable for what this does bring as a resolution. I am not in support of the resolution, and the biggest reason for me is I still believe it's an intrusion on adults' ability to exercise personal responsibility and individual liberty. And even though I am fully aware that I know that cigarette smoke is a carcinogen, I just do not believe that it is our position to have this resolution, but that is certainly my opinion. I'll leave it at that. Thank you, Mr. Chair.
Thank you, Counselor. Counselor Roby?
Thank you, Mr. Chair. I also have the same concerns, but I also am curious, and I did not talk to the solicitor, but I'm not sure what a resolution like this actually does. I could see if the Board of Health had a policy which they could then enforce, or the city council had an ordinance which could then be enforced, that would be different. So I wasn't sure if your idea was to be in support of the Board of Health having a policy, which it doesn't sound like they have talked about in detail. I know they're working on a body people policy. So exactly what do you think this, if this gets approved, and I say if, it only takes 6 votes, and I've been surprised on resolutions, exactly how will it get enforced? Because there's no law with it.
Very good. Would you like to comment?
Well,
Counselor
if
Roby?
I may, first of all, I would like to apologize. I'm not on your committee, so I realized, I said, what am I doing? Anyways, I would like to comment on that, and I see this as a resolution. I think the most important part that's in here is the fact that it's getting referred to the local Marlboro Board of Health, and I agree that this resolution, I'm in favor of it. As you know, I motioned without even being on the committee, but I'm in favor of this, and this is just not Marlboro that's doing this. There's 25 communities right now that have done it, including the city of Newton, but I see the need. I understand trying to change things is difficult. Tobacco has always been a difficult area for change, but in the respect of what's being sold here, I find tobacco as a poison, and it can poison our children. And if we start looking at changing when, or not when, but when someone turns a certain age, it should be noted that we're really not doing the best for our community. But I would, because this resolution, I believe, doesn't really create any legislation, I agree that it should be passed by the Marlboro Board of Health for their decision and regulations. With that said, thank you, Mr. Chair, and sorry I interrupted on a motion.
That's quite okay, Counselor Roby. Counselor Roby, before I mention what my intent is, excuse me, Counselor Ossing.
Thank you, Mr. Chair. So I'll just remind councilors, and you've kind of touched on it, a resolution is just the expression of an opinion, present an intent or conclusion of a legislative determined fact. So there's no teeth. This is just, I want to paint the sky green. Okay, we can pass a resolution to say that, right? So that's all this does. It doesn't commit us to anything. It just says the council's on board. Councilor Roby and Councilor Orm are correct. The Board of Health needs to take some act, just like we banned Kraken or Creighton. They got to pass an ordinance or a rule that says we're going to enforce this. The Board of Health took it up in 2024. There was some pushback. It didn't go anywhere. This would, I would assume, since if the council passes it, we'll give them a little more meat to go put something together. But again, you started, this one says 2010, so that means in 5 years, 2031 would be when we start impacting people, all right? Because you got to be 21 years old to buy cigarettes. I don't know what the rules are for vaping, but I know it's 21 for cigarettes. So in 21 years, so 2031 would be when these take effect. But when the Board of Health puts together their policy like they're doing for body piercing, Councilor Roby, they got to have a public hearing, because you're going to get folks that sell tobacco products that aren't going to be excited about it, and those that don't like tobacco products, and they'll hear both sides, and they'll come up with a position. But right now, this is just, you feel good, you say, if you like it, you say, okay, we're going to support it. But it commits the city to nothing at this point. I don't know if that helps Councilor Roby or not.
Well, no, I guess If the Board of Health actually proposes a policy, and we know the language of the policy, then having a resolution in support of that, to me, would be the way to go. This is putting the cart before the horse. You've got a whole bunch of language in here that you have no idea if will even be in their policy. I mean, it probably will be, but we don't know for sure. So why don't you wait for them? It sounds like they want to have a policy. We have Mr. Dunwoody's letter asking us to support it, but there's no verbiage, there's no order from the Board of Health to have the language written up, to have the public hearing that's required, and the ability for us to know where the city, if we care where the residents of the city stand or not. I mean, bring it back when in orders.
I'll share my intent as soon as I just bring out, I just recently, as you did, Councilor Roby, I did an awful lot of research on this and what other towns have done and so forth. And then to address the issue of those libertarians out there, it's not just allowing them to do their own thing. In Massachusetts, cigarette smoking alone is estimated to cost more than $4.5 and $4.7 billion in direct health care costs every year, with approximately $1.5 billion of those costs paid through Mass Health or Medicare, which basically means that we all are paying for those deaths or those health concerns. Speaking of deaths, last year, approximately 9,300 Mass residents died from smoking-related diseases. So my intent here was for this body to say that this is a health concern. It's been a health concern for decades, and we want to take a stronger position and send it back. You're absolutely right. It has to go down to the Department of Health. Send it down to the Department of Health with our best wishes and our support, even though it's not green in the sky. It still carries some leverage, I guess, when they're trying to put their policy together. They'll know how we feel. So I had a motion to accept the resolution. The chair seconds it. All those in favor? Opposed? The vote's 2-1. Entertain a motion to adjourn?
Motion to adjourn.
The Public Safety Committee is adjourned at 7:02. Thank you, everyone.
Vote.
Oh, this is my first public safety guy, so be cautious on me. It's unanimous, adjourned.